Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. For today's show, we'll be discussing the primary care aspect of chiropractic. When people think of chiropractic physicians, they equate us primarily with back and neck pain. But did you know that chiropractic physicians are primary care portals into the healthcare system? To help us learn more about this, today we have a very special guest joining us by phone, Dr. Bill Kleber of Berthoud, Colorado. He holds a Diplomat Status of the American Board of Chiropractic Internists and has been in practice as a doctor of chiropractic for more than 35 years. He's also an international speaker for Biotics Research Corporation on topics such as autoimmune disease, thyroid disease, and lipid fractionation. Welcome to Florida by phone, Dr. Bill.
Well, thank you very much, Laura. I'm glad to be on your show.
Okay, well, to get started on this, Dr. Bill.
What I'd like to do first is have you describe for us what you actually do in your office.
Well, Dr. Keith, when I built this office, the goal was to make it a very high-end, very professional-looking office that had everything that another medical office would have. We have, waiting rooms, treatment rooms that have sinks. We have EKG machines. Mm-hmm. We have Doppler ultrasounds. We have spirometers. We have a lab where we draw blood and we spin down the blood, and we have an autoclave to clean our equipment. You would have a hard time differentiating our clinic from any other primary care clinic. It looks like, and we dress like a professional medical office, yet our approach is going to be very, very much different. We are different in many ways. First of all, when somebody calls up for an appointment, a new patient appointment, we'll often leave an hour and a half to 2 hours for that initial appointment. I think that the case history is really important. So many of the people who start with us come in, they have chronic conditions, and they're complex chronic conditions, and they have a case history that's going to take a long time. I've had people bring me in binders, complete binders full of information. Yeah, and we base our fees actually on how long we're going to spend and the difficulty of the case and how much research we might even have to do.
Okay.
I'm not afraid to say that I have to do research. I don't think I know everything. And people have been to many different places looking for answers to these long-standing problems that they've had. And it's important to get a good timeline, to look at all of the labs, to get a very thorough case history, to find out where things have changed in the timeline and where things started going south, what medications they were on, the changes in their blood chemistries. And I think that that's a really important part of figuring out what is chronically wrong. Where did things go wrong in their life? We weren't born to be ill, and it's usually something that develops over time. We also then will proceed to a thorough physical examination where we might do EKGs, we might do spirometry, check their lung function, we might check vascular flow, we do pelvic exams, breast exams, we do pap smears, we do functional medicine, we do blood chemistries and hormone testing, and each case is individual. And we have the ability and the knowledge and the expertise to do all of those kinds of tests, but the important thing is how do we interpret it? And, you know, I've said this in the classes that I teach for the Diplomat and Internal Disorders program. I've said what you really need to do is find out what the big thing is. What can you fix? What can you fix so that there's a cascade effect and that their symptoms are relieved eventually? You can't go after each individual symptom and hope that the combination of the therapies that you're recommending don't have adverse effect. I mean, that's what medicine is. What I always say is I don't care whether something is particularly natural or whether it's pharmaceutical. I care whether or not it works. You know, people say, well, it's natural. I could give them this, it's natural. And I would say, well, you know, so's arsenic. Arsenic is natural, you know, but it's going to kill you. So and then what we do is we have a report of findings where I sit down and I take all of the history, all of the physical exams, all of the laboratory testing, and really try to explain it to the patient so that they understand what's wrong, because I think that really motivates them to follow your instructions. I tell them what I don't make promises, because I always say God can make promises, but I could tell you what I expect. But if we're not achieving the goals that I set forth, then we may need to change the treatment plan, but you can give somebody a good idea of what they should expect during the report of findings. I encourage them to bring their spouses. And after, you know, they get well, they often don't want to return to the typical medical paradigm. And they become patients for life, where we do all of their annual physical examinations. We do their blood chemistries. We make changes accordingly. And we set goals for every single patient to achieve a better level of health. I don't care if you're 88 years old, because what I say is, you know, if there's only one thing that everybody in the world can agree upon, it's that nothing stays the same. And if nothing stays the same, then your health is either getting better or it's getting worse. And we have to set goals for it to get better. So that's where I am with what we do in my office.
Just as a quick sidelight to that, I'd like to ask you, maybe you're aware of the laws here in the state of Florida. As you're in Colorado, of course, you're governed by the state laws in the state of Colorado. But here in the state of Florida, if I understand correctly, and you can correct me if you know, I believe that we are licensed to do all of that as well. Isn't that true?
Oh, you are. As a matter of fact, when I did a plenary session at the Florida Chiropractic Association convention, I did, on the panel with me was the attorney for the Florida Chiropractic Association, who validated that they could do all of the things that I just talked about in that state, and he encouraged those chiropractors to utilize their full scope of practice. Because if you don't utilize it, you're going to lose it. And he was very emphatic that all of those things are within the scope of practice of chiropractors in the state of Florida.
It's interesting you mentioned that, because I happened to be at that meeting, and I remember that exact conversation on your behalf, and then also on, I think Paul Lambert is the gentleman's name,
yes,
who spoke
Paul
on behalf of the FCA as their legal counsel, and he did say you either use it or lose it. So that's an interesting point.
You know,
Now,
I think, go on, Keith.
no, I was going to say, let's move into a little bit of the history of chiropractic here and how it relates maybe to primary care. What would you tell our listeners as to the history of chiropractic and primary care?
Well, if you start to go back to 1895 in the beginning of chiropractic, it started with a chiropractic adjustment to free nerve impulses.
Mm-hmm.
But from everything that I've read about the founding fathers, D.D. and B.J. Palmer, chiropractic evolved into a very primary care status. And we did a lot of different nutritional recommendations. Then things really started to change. You know what? I mean, I'm 57 years old, and when my mother went to the doctor, he didn't put everybody on drugs right away. He didn't. He gave some B12 shots. He tried to make nutritional recommendations. And I think that if anything happened, that the traditional allopathic approach to health was changed dramatically, much more than the chiropractic one.
Mm-hmm.
In the 1980s, chiropractic lost its way. It started to become a neuromusculoskeletal only profession, mostly because the insurances then were much different. They didn't have managed care. Everybody had insurance. They paid 80% or 90% of the bill with unlimited reimbursement with merely a $100 deductible.
I remember those days.
Oh, yeah. And there were practice management groups that taught people how to manipulate the system and make a small fortune. And it was it's what killed the goose that laid the golden egg.
I think you're right.
They used to call it the Mercedes 80s.
Yeah, I remember those days.
Because every chiropractor drove a Mercedes. And things changed. And you know, it's really time for chiropractors to get back to their root of primary care. I don't really consider the medics as having a wonderful system of primary care anyway. You know, in my opinion, it's you've got 15 minutes, here's a drug, and good luck. And that's what the system, unfortunately, has evolved into. And quite honestly, I feel sorry for a lot of medical doctors out there who wanted to get into something like what we have the opportunity to do. I think that we've charged very reasonable fees for outstanding services. It's cash only. And we'll spend as much time as we need to get to the bottom of a problem, and that's what we should do. But the system out there today is not set up to do that. It's just not set up to do that.
Yeah, I think the insurance companies have really stepped into the healthcare arena and has changed the paradigm from what it was, as you described in the 80s and before, to what it has turned out to be today. No doubt.
I think that the pharmaceutical companies are to blame as well.
Mm-hmm.
I think that we have become a drug-oriented society that doesn't take you know, Keith, what I was saying to a patient the other day is, as I'm older and I get more experienced in this, I think common sense is something that we need to prevail more than anything. I'm like, okay, you have to get some sleep. You have to eat 3 good meals a day, which we don't do. It's not even close. We have to move our bowels every day, several times a day, which in many instances we've lost our way there. We don't consider that a necessity anymore. And we have to exercise. And we have to live in we have to have purpose and understanding in our lives and live with people that we love. That's a really important dynamic that we kind of forget. And it just makes sense to me that common sense needs to be used, and people have to change their diets. The medical profession talks very little about changing your diet. We live in a high-stress society with a lot of fast foods, Look at the advertisements that are in print media and on television these days and on radio. It's all for drugs that are symptom oriented. We have to get back to basic good health habits, which we've lost. And I really think that chiropractic is in the best position of any healthcare profession to understand that and to implement it.
And Dr. Bill, I would add that common sense is not so common anymore.
I'm sorry, Laura, I couldn't hear you.
Said I would add that common sense is not so common anymore, Dr. Bill.
No, common sense isn't common anymore. You know, people go, really? I had a patient once who asked me, she said, Dr. Kleber, you know, since I've started seeing you, I move my bowels every day. And she was in her early 30s. She said, I spoke to a friend of mine who said that her doctor said that it was normal to move her bowels every 2 or 3 days. Which is it? You know, anybody with common sense has to figure that moving your bowels every day is a necessity. And we've compromised some of these things.
And that leads to a lot of
because it's convenient not to.
It has led to a lot of the chronic diseases that we're seeing today, that's for sure.
Oh, absolutely. A lack of detoxification.
Yeah.
Inflammation. The immune system responds to all kinds of situations, including constipation. I think a lot of people have intestinal dysbiosis, which means abnormal bacterial flora in their intestine, and that's part of it. I think one of the, like common sense, I think most people are dehydrated. I think that they're severely dehydrated. We're drinking energy drinks because we are tired. We're drinking caffeine because we're tired. We don't drink enough water. And another thing that's just one of those crazy common sense things is we have vilified sodium, and we need things like sodium. Mm-hmm. We need much more potassium than we have. We're supposed to get 4,700 milligrams of potassium in our diet every day. A banana has about 425. We don't come close to becoming alkaline by having the right balances of these electrolytes. And sodium pushes fluid in the cell. We've been told don't have any sodium, and that's not true. Don't have any table salt, which is very acidifying, but sea salt and things have up to 100 more minerals in them than table salt, and they're very alkalinizing. Mm-hmm. And they'll push fluid into the cell. Without sufficient sodium, the cell is dehydrated. And if you're dehydrated on the cellular level, you can drink all the water you want, but if you urinate the water right out again and it doesn't get into your cells, it's useless. So we really have lost a lot of common sense things.
Okay, leading to another question. People might be wondering why it is that chiropractic physicians can be involved in primary care, because when they think of primary care, they think of the GP giving them some kind of medication, or maybe even referring them for some type of surgery. How is it then that chiropractic physicians can be considered primary care without utilizing medication or without utilizing surgery, which we can't do because of our laws governing?
Great question. I'll tell you what, I have 4 children who have never been to a medical doctor. My wife has never been to a medical doctor since we met, other than when she had children. She had some midwives. I think our first kid was delivered by an OB, but other than that. And, there's different components. Everybody thinks that you need to be able to prescribe drugs in order to be primary care, and that couldn't be further from the truth. There are really 5 different components to primary care. The first one is accessibility. And, doctors of chiropractic are licensed in all 50 states, and they practice in all different settings, rural settings and metropolitan areas. They're everywhere, so they do meet the standard for accessibility. And then the second one is what we call a comprehensiveness of service. We need to be able to diagnose and differentially diagnose and be able to treat different disease processes and be able to take care of people from pediatrics to geriatrics. We're not specific to any organ system or pathology or methodology. We provide non-surgical, non-drug, holistic care. We are much higher up in patient safety than people who prescribe drugs. So, and the third one is something, coordination of services. The primary care doctor has to be able to recommend to other specialists, and we certainly do that. We need to be able to diagnose and refer to the appropriate person and to perform appropriate testing. And so we do that. The fourth one would be continuity of services, where the primary care provider has to refer and incorporate this into the patient's records and make sure that the treatment is continuous, even if something happens to that doctor. So we have to provide we have to write the right kinds of notes, the subjective, the SOAP notes, so they call them.
Yes.
Subjective, symptoms, objective findings, the assessment, the plan, so that other doctors can follow through if you change doctors or the doctor dies or the patient moves. So through our notes, there can certainly be continuity of services. And the fourth one, the fifth and final one, would be accountability. We're obligated to provide information about risks and benefits of care and make financial agreements and talk about commitment to treatment and patient outcome. And so those are the 5 components of primary care, and chiropractors can certainly fill those all of those components, and with proper training, they can certainly be primary care from cradle to grave.
Okay, that's interesting, Bill. And I know, having gone through the Diplomat Status program that you are a teacher of, I remember hearing of those 5 components early on in our education and training with that program.
So sometimes you sit back and you say, well, what can medical doctors do that I can't do? Mm-hmm. Well, surgery. Yeah, I'm not real interested in that. Delivering babies. Yeah, I'm not real interested in that. Prescribing drugs. Yeah, I'm not real interested in that either. There's a lot of controversy in the chiropractic profession about the use or limited use of pharmaceuticals. I think with proper training, we could benefit to a certain degree from using them. However, I think that it just became way too easy for the medics to start prescribing medications to mask symptoms and not get to the cause of the disease. It's much harder to figure out what the cause of the disease is and to change some of the lifestyle and nutritional habits that patients have so that they really get over it. I mean, you could fix type 2 diabetes. Mm-hmm. You could fix hypertension. There's a lot of chronic, complex diseases that people are developing way too early on in their 40s. And all that the medical profession does is mask the symptom, but they don't get to the cause of the disease. Mm-hmm. And that's what we always have to remember as chiropractic physicians, is that we need to get to the cause of the disease and fix the cause of the disease and not just allow the symptoms to be alleviated by either pharmaceutical or natural therapies, because the patient has to continue to improve their health, and they're responsible for it, and they have to work on it every day.
Bill, I think you're right in that people are getting very frustrated by the medical community when they go in to find out what else they could do and they're just prescribed a drug. It just feels like a masking effect instead of a let's fix it.
Yeah, Laurie, you're right. I see on my patients' faces when they come in here for the first time the frustration that they've experienced in going from doctor to doctor looking for a solution. And, a lot of times they've self-medicated with natural things since they can't find somebody who can help them really fix their problem. They go onto the internet and try and seek out the solution themselves. And while I applaud that, they don't really have the experience and probably not the background to do a really thorough job. They get bits and pieces. I do this all day, every day for years and years, and I know what's worked. I know what in theory is supposed to work, but I haven't seen it work, and it's called, it's experience. I could go and read something on how to be a plumber, which I am the least handyman in the world. And I guarantee you that if I follow the steps, it's going to the pipes are going to probably leak, or I'll do something really bad. My wife actually forbids me from doing electric or plumbing. But to a plumber, it's easy. He knows he could diagnose and fix a problem real fast. I had a problem with my boiler, and they had to come over and fix it yesterday. I'm more than happy to pay somebody who does something every day and is ready for the more complex problems. And that's what I feel I have to offer. Because I do this all the time, I have a deeper insight as to how we could remedy the situation and fix it.
Thanks, Dr. Bill, for all that great information. I'm sure our listeners appreciate it, and I'm sure they learned something as well. Well, join us next week for a continuation of this discussion with Dr. Bill Kleber from Berthoud, Colorado, on chiropractic and primary care.
Well, that about wraps it up for another edition of the Chiropractic Corner. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, @gmail.com. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner right here on WJUP The Jupe, 103.9 FM, Friday morning at 9 a.m. right after the Dick Farrell live show, and again Saturday right after the 10 a.m. news. Until then, be well, live well. We'll see you next week.